There are only about one medical doctor for every 22,000 people in the Central African region. Most of those are concentrated in the bigger cities. So as Encompass began the medical work, we started looking at the fact that there are no health centers, there are no dispensaries in regions in which we would like to work. So they have to typically walk 10, 20, 30, 40 kilometers just to find any kind of health care. So what we were able to do is bring something that people really need, which is healthcare, into an area. And by doing that, show them what Jesus is really all about. He cares for people. He cares for people that other folks might not care about. Encompass World Partners began their medical work in the Central African region. Frank Poole was originally there working with our evangelist, Daje Samuel. They began with a small dispensary, or we would call it a health center, in the south of Chad in a village called Dodang 2. That was in the heart of the Laka region, which was the people group that we initially started to work with. Currently, Encompass, in partnership with the Association of Grace Brethren Churches, as they're still known in Chad, has approximately 13 small health centers, dispensaries, in the south of Chad, as well as now in the east of Chad.
You think about what Jesus did. I mean, that he went and healed people and, gave people what they needed. And then when you can help them physically, then they're more willing to listen to you and hear what you have to say. So there's just so much opportunity there.
Chad's a really hard place, and sometimes it is difficult to share with people Christ's love. Often some of the tribes and cultures tend to stay within themselves. So a lot of our evangelists / nurses and midwives, even the surgeons, are missionaries, because they're taking their skills, their God-given calling, if you will, into another people group, another area of Chad. It's been a process over the years of sending men and women to be trained, both not only in the medical field, but as well as in evangelism. So every dispensary, every surgical center that we have is run and managed by our Chadian partners. We just would like to encourage folks to be actively involved in prayer for Chad and Sudan. We need people to encourage. We need people to, support financially the work there, and to understand that this isn't Encompass World Partners driving this. This is Encompass World Partners partnering with a national association who is understanding the need to reach the least reached.